Noise phobia is everywhere, and it can look like anything. It can look like house training accidents, refusal to go outside, trembling, shaking, destruction, even aggression toward the pet parent during a stressful event. And I have 5 easy tips for you to get a big win when treating these noise phobia cases in dogs. Tip number 1, ask about it. Oh, I hear you. Oh gosh, I don't have time in the exam room to take a good history. Look, there was a nice study that came out last year that showed that using a short questionnaire with just a couple of questions massively increases the likelihood that you're going to get good information about behavior problems. And I strongly recommend that you have your nurses and veterinary assistants take that history for you. So by the time you walk in the exam room, you know exactly what you're dealing with. Tip number 2, talk about it. Make sure people understand that dogs grow into noise phobia, not out of it. They're going to get worse with time. Help people to understand that dogs that are painful will often show signs of noise phobia when they're 5 or 6 or 7, even if the pet parent didn't notice it before. Make sure you do that really good medical workup and talk to people about why that is absolutely necessary. Remind people that this can also be inherited, meaning that it doesn't have to be a hugely traumatic experience that caused the phobia. It can be something passed down from the parents to their particular dog. Number 3, medicate for it. Don't be stingy. If you have a patient who's scared of something that happens every single day, like they're afraid of storms and you live in a place with a lot of storms, or if they're afraid to walk outside, so it's quite generalized, you're going to need something every day, right? Whether that's going to be a supplement or a medication is going to be up to you, but you're going to need something to cover that pet for that fear all the time. You may also need a short-term medication. Maybe you're going to use it while the long-term medication takes effect, or maybe you're going to use it for events as well as that long-term medication or supplement. Remember, if you're using those short-term meds, to administer them well before the stimulus. And if you can't predict the stimulus, as we cannot here in South Florida with our storms, we just tell the client, okay, administer that medication when there's a 30% chance or more of rain. Now, I understand that sometimes those pets will be medicated and the rain won't come, but it's worse to have a panic attack than it is to get a little Valium and be a little high for part of the day. Number 4, change the environment to decrease the behavior. This is so simple, and studies show that you can change behavior by up to 70% just by doing simple things like closing the blinds during storms, using classical music or white noise during sound events, and creating a safe space where the dog can settle down. And number 5, help the pet cope with it. Did you notice I never said ignore the pet during the event? Let's not do that. That is old stuff that we do not want to do anymore because we know better. Studies show that pet parents can pet their dogs during stressful events and they won't make the behavior worse. Matter of fact, it looks like from the latest research that if they help their pets cope by petting or cuddling with their dogs, it actually has no effect either way, positive or negative. The most likely way to help the pet based on research is to use food, toys, and play during noise events. Just like you would with a child, distracting a dog while it's scared helps it to get over that scary event. And actually, it helps change the behavior long term based on the latest research. Follow my 5 tips, ask about it, talk about it, medicate for it, change the environment to decrease it, and help the pet cope with it, and you will have big wins treating noise phobic patients.